There are things that we take for the board that are well known to be outdated, and it creates a dilemma for students and confusion. Do I study what I know is not current and what's wrong for the sake of just passing an outdated question? Or do I, stay current on what's actually happening with what I'm learning in class and so forth? So there's that discrepancy as well between national standard test taking and what is being taught in schools as well.
Welcome to the Prospective Doctor Podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello, everyone. I am really excited to dive into this conversation today. It's me, Dr. Erkeda, here with Dr. Raji Akileh. I'm just going to let him have an opportunity to tell us a little bit about your journey to medicine, and we'll go from there.
Yes, thank you. So I'm Raji Akileh. I'm a DO, and I never imagined that, I would leave clinical medicine per se growing up. I've always envisioned that I would go into pediatric oncology. However, when I made it into medical school, I was a little bit shocked at the current state of medical education. And, with it being 2023, I was a little bit, I guess you would say, dumbfounded by the fact that we haven't integrated lifestyle medicine yet into our core curriculum. And there are several other things, economics and so forth, that really are missing from our curriculum. And so that led me to kind of embark on this journey of trial and error through medical school and kind of building something out in the background. There was a series of events that made the light bulb go off in medical school. But when I graduated from medical school, I had a decision to make whether I would continue on in my training through residency or go down the startup rabbit hole, so to speak. I've decided that, I was very passionate about this idea that I created. And after some events that occurred that really pushed me over the edge, seeing things that should not have happened, it really kind of set the fire off to come up with a solution. And so since coming back home, I've been embarking on this journey with MedEd Cloud that's set to work to redefine the future of medical education and training. And that's how I'm, being tied here. I came across Dr. Erkeda on LinkedIn, and I reached out, and so I wanted to discuss further and, learn more about her journeys as well.
That is an awesome story, and I think that it may resonate with a lot of our listeners because we all know that the education system is broken, and we've all started our journeys into medicine for different reasons. But I think the ultimate goal for most people, even though it sounds really cliche, is to help people. Yeah. So we gain so much knowledge and we have so many transferable skills when we get into medical school as we go through the process that sometimes there are other routes, long story short. So people may become afraid. And I think there are a lot of people who kind of come to this little fork in the road and they're like, I really want to continue with clinical medicine, or I think there's something else that's a better fit for me, but I may not have the training. I've kind of given my whole life to medicine and all of these things. So I'm really curious to dive into your story because, like you said, we need to revolutionize medical education. So that's your way of helping people because there are thousands of medical students out there, or tens of thousands of them. And there are so many things that do not fit into the traditional medical education system because our system in the U.S. is over 100 years old. And we have not implemented things as technology has come forward, as things like lifestyle medicine you mentioned are very important and should be the pillar of healthcare to kind of prevent people from needing certain services. So I'm going to stop talking here. And I'm going to just kind of let you tell us a little bit more about MedEd Cloud.
Yes. So, when everyone asks, what's the solution, it's granted before I begin, discussing this, I will always preface this and give a kind of a snapshot of where we sit today. Medical education, where it sits as of today, is very, very resistant to change. And, within each, type of, route you consider within the entire continuum to bring a medical student from day one all the way across graduation stage, there are a lot of, people that, how would I say, rooted in tradition, unfortunately, and, can kind of create some friction when you talk about change. And granted, change is a very hard topic to come across, because when we're comfortable and we're set in our ways, to consider something different is often, a little bit hard. And so that's kind of what may cause some of those reservations. Now, with MedEd Cloud, what we're doing is we're working to create this platform that will be onboarded into medical schools. And so it will essentially, on a very high level overview, address these particular components that are missing in our curriculum, find ways to interject them into the training process. In addition to that, it will ensure that students are staying up to date on the latest trends and what's occurring in the healthcare space, and ultimately create a more well-rounded physician who graduates from medical school. So that way, when they get to the point of residency and beyond, they're already well caught up with this rapidly changing landscape in medicine. And to your point that you were pointing out, we still operate, I always make the joke, we operate as if we're running on a 1950s model, because at the time, the amount of content that doubled occurred every 50 years. As of today, it's doubling every 2 to 3 months. And so there's been this exponential explosion, yet the system as a whole has not adapted to meet that reality. And so that's kind of the premise right there.
I couldn't agree more, because when you think about it, a lot of the syllabi and the books that they are based off of are basically obsolete by the time they come out, because it takes so long to publish things. And we're learning this medicine, and of course, the human body doesn't necessarily change the way it functions. Most of the time, anatomy is the same, but you can learn it in a different way. But there are a lot of technologies and newer medications and new findings that come out almost every day. So by the time we're learning this education, like during our preclinical years and even during our clinical years and beyond, because medicine is a lifelong learning process, some of the stuff is old.
Yep. Yeah, and definitely. And two, speaking to some of that, there are things that we take for the board that are well known to be outdated, and it creates a dilemma for students and confusion. Do I study what I know is not current and what's wrong for the sake of just passing an outdated question? Or do I, stay current on what's actually happening with what I'm learning in class and so forth? So there's that discrepancy as well between national standard test taking and what is being taught in schools as well.
I love that, because I think that a lot of people struggle with that, because as we know, patients don't always read the books necessarily, but a lot of our standard tests and exams are based off of the perfect patient.
Yep.
Are there opportunities with MedEd to have mechanisms in place to do board study, or is this specifically just in terms of like new information that's coming out? Like, what resources are available?
Yeah. So, when it comes to board studying, it's very integral and integrated into MedEd Cloud to ultimately ensure that as a student progresses through medical school, that they will be receiving real-time feedback analytics on their board preparation as well, and to ensure that they are ultimately prepared to take their exams in that regard. So then the schools will be able to monitor students' performance, get feedback, find ways to actually do quality improvement from a whole as on level of the school. And then students are able to not be left in the dark. And that's one of the things, too, with the USMLE Step 1 becoming a pass-fail exam. There's a paradigm shift. Students usually required, Step 1 to get a good residency. If they did not do too well on Step 1, Step 2 was kind of seen as their saving grace to kind of act as a buffer for residency for competitive ones. But now if a student goes into a pass-fail exam, and there's no really objective metric, if they do poorly on Step 2, now all of a sudden there's no recovery for the residency programs. So it's creating a little bit of a dilemma right now in that regard. But, it's something that's, I guess, changing currently, and they're talking to their rationale behind some of these decisions they're making.
I think that's really interesting because that actually shows like how outdated our education system is right now. Because like you mentioned, a lot of times, and for the listeners out there, I'm going to back up because we have a mix of listeners of pre-meds and med students. So the ones who are pre-meds may not know anything about what we're talking about because they're focusing on the MCAT. So spoiler alert for those who are listening who are in pre-med, there are many, many more tests ahead. So once you get into medical school, you'll do your preclinical years of typically your first and second year. Some schools are set up a little differently, but after your first and second year of doing tests, exams, and stuff with your instructors, professors, you'll have to take a national board exam called the USMLE Step 1. Traditionally, it was scored with certain scores, kind of similar how you have to get a score for your MCAT, but there has been discussion as to how to make the process better because some students, some specialties would not even consider you to become a specialist in their field in terms of getting a job after you graduate. Say you want to become a neurosurgeon or radiologist or something like that. You would have to have a certain score cutoff to even be considered. So there are some great doctors out there who may have wanted to go into a specific field, but because they didn't have the certain test taking skills and things like that or scores, they weren't considered. So they're trying to take some of the pressure off of people and make it pass fail, but they only did that with Step 1. So there is a Step 2 that has 2 parts where you have to apply some of your clinical things that you've learned in your clinical years of medical school. And then there's another crazy exam that you have to fly to certain cities and see patients, and they want to see basically if you can communicate well. Then after that, after you've graduated and you've been a doctor and you've done residency for a year or so, you sit and you take Step 3, which kind of builds on Step 2. And then after that, you sit for your board exam after you finish residency. And then you keep doing it over and over and over. So lots of exams, but now there's this dilemma because now Step 1 is pass-fail. What does that mean? What is pass? What is fail? It's still scored. They just don't know what it is. And moving forward, are they just delaying the judgment till later? So you take Step 1, you apply to a very competitive specialty, and then they start cutting you off with Step 2 scores. So that's kind of where we're at.
Mm-hmm. Yeah, definitely. And two, one of the things that comes with the pass-fail system, and, granted, there's pros and cons to any type of decision that's made and the type of impact it has. But, it gives, it keeps students in the dark, so to speak. They don't know exactly, how they're progressing before. And then, so as you alluded to as well, you're kind of kicking the can down the road for Step 2. And then really you see how ultimately you perform on your Step 2, applying some of the Step 1 principles into Step 2. And you find out, hey, maybe I'm not as strong as I thought I was, even though I passed my Step 1. So there's that as well.
Yes. So it seems like MedEd Cloud can give you some guidance and analytics to help you set yourself up for success.
Yes, definitely.
So for people who may be interested in working with MedEd Cloud, does your school have to participate in it with the organization in order to become a member, or can you do it out of pocket? How does that work?
Yeah. So, one of the things that I'm looking to do as part of the go-to-market strategy, one of the startup terms, we're going to focus on creating a list of 10, quote, pioneering schools, so to say. The schools that are going to advocate for what the future of medical education and training will be. And as that occurs, the schools are going to benefit and be able to contribute as well to the development and the roadmap of some of these educational initiatives. And then as expansion occurs, we're also going to provide the ability for medical students at a school that doesn't have this platform inside of their own program to actually buy into it through some sort of subscription or whatnot. So then they would be able to access the same type of benefits that would be afforded to them had their school had this platform. So it's a way, because as I alluded to, medical education is resistant. And so that's hence the reason why is, we're taking this, I guess you would say, top down and bottom up approach to start addressing some of these problems in medical training.
That's awesome. Outside of looking at analytics for certain tests and things like that, as you mentioned earlier, there are some gaps in our education.
Yeah.
So for instance, lifestyle medicine, the business of medicine, and things like that. Are there any modules or opportunities to learn about that through this process?
Yeah. So, as the student is able to go through their training and leverage MedEd Cloud and so forth, it will be able to identify where these weak points are, where these gaps are missing in the curriculum, and being able to ensure that the students are getting the proper training with some of these components as well. So in addition to lifestyle medicine and medical economics and so forth. There will be also some additional innovation focuses and so forth. So how to actually help the healthcare system when it's sick as well, because one of the things in medical school is we're trained to treat patients when they're ill, but we're also looking to train our future physicians to treat the system when it becomes ill as well. So
I love that. I think that you shared so many great opportunities for like a medical education revolution. So I'm sure that we'll be hearing more about this. And I think that your last statement kind of pushed me into my final question for you. I love asking our guests this question just because it's so different for everyone. So as you mentioned, our healthcare system is sick. The U.S. healthcare system is not perfect. There are a lot of opportunities for growth. If you had a magic wand and there was anything that you could change about the healthcare system, what would it be?
I would say the biggest frustration about our healthcare system, from my own individual perspective, is I have a huge problem with prioritizing gross profit margins over human life. Some of the decisions being made in our healthcare industry ultimately impacts the care that is afforded to patients. And some people from different communities don't even have that privilege to access healthcare services. And so, it becomes a matter of redefining what gross profit margins mean. And, at what point of course, we all want to be comfortable in life. And, of course, we have to keep the bills, the lights on and everything. But at what point does it become gluttony? And then because these decisions have downstream effects, and someone's loved one who passed away due to poor health care, they have the burden of carrying that pain with them for their whole life. So that's my biggest frustration.
I couldn't agree more. And we could talk hours and hours and hours about that. And I'm sure that a lot of the listeners have heard me complain about it. I think what you're saying is absolutely correct. And I love that's why we have all of these listeners here, and we have organizations like MedEd coming forward that can teach physicians the business of medicine and how to go about certain things and how to empower themselves and perhaps pursue co-founding a startup or working as a chief medical officer at one, because we need physicians leading these organizations that know what's going on with patients and have that in mind. Because yes, companies have to stay afloat, like that's why you have a business, but patients should lead that reason. And we should work on decreasing health disparities and working on health equity and working on access to care and working on ways in which we can be comfortable and pay our bills. Yes, a lot of you out there, including me, have student loans, but we got to pay those. But at what point do we advocate for those who may be less fortunate and who have these health issues? And it shouldn't cost a certain amount of money to live. Like, I know that there are all these debates and stuff out here about healthcare, but I believe healthcare is a human right. Like, just because you have money doesn't mean that you should suffer and have poor care. So that's a whole nother discussion. But I really enjoyed chatting with you, and I just want to give you an opportunity to tell our audience goodbye and share any information into how they can connect with you or MedEd Cloud.
Yes. So I wanted to thank everyone for taking time to listen. You know, I'm Raji Akileh. I'm a DO. If you search me on LinkedIn, Raji Akileh, DO, you'll find me. I am on the board of advisors for Global Health Impact Network, which is a global network of doctors driving innovation in the medical field. And so I would encourage everyone, in addition to learning about MedEd Cloud, following on LinkedIn and so forth, please learn about Global Health Impact Network as well. Learn to get involved. And thank you so much, Dr. Akita, for giving me time to discuss this with you.
Well, thank you so much for coming. And for all of those listeners out there, feel free to click subscribe, share this with your friends, because I think that this is an important conversation for everyone who's interested in medicine. For all of those that may be listening to us on the different apps, I want to announce now that we have a YouTube channel. So definitely check out the Prospective Doctor there. And if you have any recommendations for any potential guests or topics that you would like to talk about, please send me a message at Dr. DeGram, DOCTOR, the letter D, GRAM on Instagram. And I'll be sure to try to connect it with you. Have a great day. Bye.
Thank you.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward medical school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.